Hey guys, this is an important segment. March is Colorectal Cancer Awareness Month, and Texas Oncology wants you to understand the disease's prevalence and treatment options. So, David Mccollum, medical oncologist at Texas Oncology, joins us today to break down the signs and symptoms and also to discuss treatment options. Good morning. Thank you so much for joining us.
Thanks for having me here.
Of course. So we really want to create awareness around the subject because we believe education, knowledge is power. So how common is colorectal cancer?
That's a great question. I think that's the key question for this month, Colorectal Cancer Awareness Month. It's common, and it's in fact the second most common cause of cancer-related death in this country. So rates have been slightly declining recently, but we've seen an uptick in cases in younger folks, and so that's important to recognize. Number of things that can be done to kind of impact on that we're going to talk about, I think.
Yeah. So you were talking about how the second highest, who's the most at risk? Who should be listening to this?
Well, that would be everybody. So everybody's at risk for colorectal cancer. We know that there are some segments and groups of the population that are at higher risk, but everybody has some risk. And so that is the importance of sort of screening everybody.
Yeah. And what can be done to prevent this? Because we always want to give people actions that they can take. What are lifestyle things that we can do?
Well, so maybe back to just the thread we talked about a second ago, there are some groups that are at higher risk. We know that family members of folks who have had cancers or polyps in the colon, folks who've maybe not led the healthiest lifestyles. We know that smoking and heavy alcohol use can be risk factors, overweightedness. But to your question about what can be done to reduce that risk, we know that screening is really important. And unfortunately, recently with the COVID pandemic in particular, we know screening rates have dropped a bit. And so it's time for people to get back in with their doctors and get back on track with their screening. A number of different screening options that are known to be effective and safe and relatively easy. Still struggles a little bit with its PR, but I think colorectal screening is growing in terms of our compliance rates.
Yeah. And when we talk about treatments, what options are out there? Have there been advancements in recent years?
Yeah, there's been a lot of breakthroughs recently. The way I look at it is the best way to treat colon cancer is to try to prevent it. But unfortunately, we know that there's still going to be cases diagnosed. And so the earlier it's diagnosed, the better. We know that if you find colon cancer in its early stages, it's highly curable, over 90% cure rates with oftentimes just a minimally invasive surgery. Some patients will need other treatments such as radiation and chemotherapy. And as an oncologist, that's the part I oversee. And I think there's a lot of fear and worry about that. But the advances in recent years have made those treatments much more manageable and much less toxic for folks. Ablation procedures, specialized forms of radiation such as proton beam radiation is a big advance in recent years. All of these are impacting, quite a bit on our patient population.
Really quickly, you were talking about early detection. So people that are resistant to screening, there's just anxiety there. What would be your one message to them?
So I think the important message is talk to your doctor about screening because there's a number of different tests that are out there, not just the conventional colonoscopy or procedural-based tests, but there's also home tests that can be safely performed and maybe don't have that same anxiety and stigma. Yeah.
All right. And if people want to learn more, because knowledge is power, how can viewers learn more about prevention and treatment of colorectal cancer?
So a lot of good resources out there, but I would direct folks to texasoncology.com. That's our website. A lot of useful information about early diagnosis, screening, treatment options, some of the things we've touched on this morning.
Thank you so much for joining us.
My pleasure.
Okay, and like we said, guys, numerous options are available to patients ranging from at-home tests to in-person screenings. Depending on age and risk factors, talk to your doctor today and visit texasoncology.com to learn more.